Okay, so now we're talking braces 101, and here to help answer those frequently asked questions that we may have is Dr. Donna Galante from Cater Galante Orthopedic. Welcome. Orthodontic, excuse me. Different, very different.
Very different part of the body.
So, how do we know when kids need braces?
Well, usually it's somewhat obvious, right? You can see some crooked teeth, maybe teeth sticking out. However, there are problems that are not as noticeable, such as bite problems, especially on the back teeth, called cross bites.
Okay.
Sometimes a child will have a overbite.
Ooh.
The teeth may look straight, but their teeth overlap too much. And that kind of problem really should be addressed early. And the American Association of Orthodontists recommends all children be seen by age 7
is
for
that right?
an orthodontic evaluation.
Okay.
Yeah.
The earlier the better, I would think.
Absolutely.
Yeah.
The earlier the better.
And how do we know what kind of braces? I mean, when I was little, when I was a kid, I sound so old when I say that, there was just one type of braces to get, but now there's so many. So how do we know which one to get?
Well, and again, if you go to see an orthodontic specialist, they will give you options. I mean, traditionally, everyone's very familiar with these metal type of braces.
Yes,
right?
those look familiar.
Right, and these have been around for over 100 years, and they work very well. Obviously, there's some issues with wires maybe poking, and you probably remember that experience.
Yes, I do.
And some trouble brushing and flossing. They come in different colors now, so you can get them in clear and even gold.
Oh wow! Oh, you're kidding me.
No.
Oh my gosh, you could have like a grill.
You could have a grill of gold.
Wow. Okay.
But I would say the latest is Invisalign, which are clear, removable braces, which is kind of nice because you can take them off and eat whatever you want.
Oh my goodness, I didn't know that.
And you can brush your teeth and floss really well. And they're virtually invisible, so especially if you're an adult, social settings, this is a much better option, right?
Yeah.
And honestly, we treat kids with the Invisalign. We have patients as young as 7 years old with these on, and they do really well. They're very comfortable. A lot less discomfort.
Yeah, and so you mentioned about brushing and whatnot, but before that, foods. What when you get braces? I remember this too from my orthodontist. What foods and whatnot should kids be eating and be concerned with?
So if you're going to do the traditional, we call it the traditional braces, you got to watch hard, sticky, chewy foods. No chewing gum, no popcorn, taffy, Laffy Taffy, Starburst. So you got to watch it because anytime you eat something like that, it can knock a bracket off, right?
Yes.
And then you have those pokey wires.
Yes, that also happened to me too. This is like my childhood coming back to me.
That is one big disadvantage. With Invisalign, obviously, you take them out, you chew the gum, you eat the popcorn, you eat those Starbursts, brush your teeth, and put your aligners back in. So there are some unique challenges. Either way, you still have to brush your teeth and take good care of them and floss, after every meal.
I was going to ask that too, as far as brushing and flossing. What should we do there?
We tell our patients to brush after every meal, whether you have Invisalign or braces, and we encourage them to floss daily.
Okay.
Because that is really the best way to keep your teeth
clean
and free of any sort of potential decay.
And make sure there's nothing in the braces too. That was always a big thing
like
too.
Spinach hanging off or something like that.
Yes, I also have that as well. So folks who may not be familiar with Cater Galante, tell us a little bit about your practice and why people should choose you.
Right. So we have a unique situation. My husband and I practice together.
Yeah.
Okay. And we have been together in practice over 24 years.
Oh my goodness.
Yes. And we've been in Sacramento over 20 years. And between the two of us, we're like almost 55 years of experience. So we have a lot of experience and we offer a lot of different options. We specialize in Invisalign. And I would say one of the things about our practice that people absolutely love is that you can come into our office and no goopy stuff in your mouth. Do you remember those goopy impressions that you had to get molds? There's now technology out there where we can take a 3D image using a camera and have an imprint of your teeth done without any goopy, messy molds. And we can do that in less than about 5 minutes.
Oh my goodness. That alone, you've sold me already.
That alone is a huge, huge benefit for patients. Yeah.
And even better, you brought a special offer with you today too for our viewers out there.
Yes. So for all our viewers, we offer complimentary consultations. There's no obligation. It's totally free. We actually will do one of those 3D images for you and actually show you what your teeth will look like. We can actually give you a simulated result in less than 2 minutes. So you can look at how your smile will be before you decide to go ahead with treatment or not. And it's all complimentary.
Oh, that's so exciting.
Isn't that exciting?
Too. Oh, that's
Yeah.
really exciting. And where can folks go for more information?
Well, we have a website called Love My Smile, LUV, mysmile.com. And if you want to learn a little bit more about Invisalign, you can also go to the Invisalign website and learn a little bit more about Invisalign and those options as well.